Hello, everyone. Welcome back to part 3 of the Pediatric Summit's 8-part webcast series. We have with us tonight Dr. Martin Rosen. Dr. Rosen is a phenomenal chiropractor and teacher, and I believe, you can correct me on this, but is Wellesley, Massachusetts?
Yes, you got it right.
I'm from Savannah, Georgia, so I say it a little differently when I read it. So Dr. Rosen travels the world teaching SOT and pediatrics and adjusting, and has been for many years. So we have a ton to learn from him. How are you doing tonight, Dr. Rosen?
Doing great, doing great. It's a beautiful day here. We've got some sun finally, so it's been nice, and we've been in town for a little while. No complaints.
Awesome. So our topic here tonight was CSF flow and dynamics and how it relates to the nervous system and overall health of your body.
Okay.
So this year alone, in the news and like all national coverage has CSF flow has been in there,
right,
with the stuff that Dr. Scott Rosa has been doing, and the MRI and football players and concussion relief. So CSF is kind of a hot topic right now.
Good. It's about time.
For sure. So for everybody who's just joining us and students and whatnot, what in a brief statement or whatever, what would you say is the CSF, and what is its role? And
the CSF itself? Okay.
Yes, sir.
So the CSF can basically be considered a vital fluid to the central nervous system. It is that fluid that helps bring nutrients to that system. It helps remove toxins. It's kind of the lymphatic system for the central nervous system. It pulls out those toxins. It also forms a protective barrier as a cushion, both a physical protective barrier, stopping the brain from bouncing off into the skull, and as a chemical barrier. It is part of that chemical barrier why certain substances don't get into the brain. Besides the blood-brain barrier, there's a CSF barrier. The other thing that CSF does, which people don't really understand as much, is that it also helps temperature control of the brain. It's kind of like cranial antifreeze. Areas with too little CSF can get too hot. Areas with too much can cool down too fast. So that affects how the nervous system works. And probably the last thing that CSF does, especially in the pediatric patient, is it is responsible for part of the growth and development of the cranial bones. The internal pressure that the CSF puts against the periosteum of the cranium as it's developing also makes sure that the cranial bones develop normally, as long as there is normal pressure gradients within that system.
Cool. Yeah. So that was great. That was very, very concise. So in maintaining the integrity of the nervous system, we pretty much covered some, but is there any more you'd like to say on that? Or
Sure.
Okay.
So the system that we really have that deals with this is the duromeningeal system. Now, the duromeningeal system is basically a tube that attaches at the second sacral segment into the filum terminale down to the coccyx. It comes up through the entire spinal column, attaches to every single dural port, attaches directly to the nerve through dentate ligaments and the epineurium of the nerve, comes up, attaches to the base of the foramen magnum, comes into the skull, and then it forms a cranial dural membranes. And in the pediatric patient, it actually comes up through the sutures of the skull and forms part of the periosteum of the cranium. So it is a tube that actually not only controls brain growth and development, but actually controls tension on the actual nervous system and the nervous tissue itself, both the spinal cord and the exiting nerve roots.
Wow. Yeah, I didn't even think about going all the way up into the sutures. That's very expansive.
Yeah. I brought a friend here, if you can see this. I want you to bring my little baby here, little baby head. If you can look at this little baby head, can you see that?
Hold it up a little bit.
How about here?
Here we go.
Can you see that? So what I want you to look at is the sutures in an infant are not formed yet. So these soft spots that we used to call the anterior and posterior fontanelles are also part of that whole cranial duromeningeal system. And the sutures get formed by the internal pressures that are also formed by the duromeningeal system as it exits part of the cranium and forms this periosteum. So we're talking about an infant. We're talking about basic growth and developmental processes. And if you look at the infant cranium, you can see here that because these sutures are so wide open and they're interlocked like they are in the adult cranium, they don't work as much as a protective mechanism when we're talking about later on, like for concussions and head trauma. But what they do work as to help facilitate normal brain growth and cranial development. I'll put my friend back. He's tired.
So that's very enlightening. And so what's very important that most people know is that this flow needs to be kept intact. The
Right.
flow needs to happen for
Right.
nutrition, for just like you said, the temperature regulation and everything. So what controls and influences are there to maintain that flow?
Okay, so the system is intricately related to the dural meningeal system, is related to the fascial system. So as you know, the dura attaches to the fascia, attaches to the epineurium of the nerve, the fascia attaches to the muscle, and also the vertebral column, the bones, and the sacrum. So the things that influence it, for example, are tension in the sacroiliac joint of the sacrum, so what we call sacral nutation. So every time you walk and move, the normal mechanics of your pelvis moves the sacrum, or creates what we call sacral nutation, and that helps effectively move cerebrospinal fluid throughout that system. So anything that affects the dural meningeal system also affects the fascial system. So we also have two sets of fascia. We have the transverse fascial planes, for example, the diaphragm, the pelvic transverse fascial planes, the thoracic fascial plane, and then the base of the cervical spine, the rectus capitis posterior muscle, and then the cranial fascia formed by the tentorium and the falx. So any movement of the actual structural bones where the dura is attached changes the tension on the duromeningeal system. So when we talk about what affects it, it's pretty much anything that ever affects what we do in chiropractic. Any adjustment you make, whether you make it to the atlas or the T6 or the sacrum, it changes the tension on the duromeningeal system. And any biomechanical anomaly, such as instability in the sacroiliac joint, imbalance to the weight-bearing mechanism, loss of normal sacral nutation, that also affects the duromeningeal system because it affects the motion and the pumping action of the duromeningeal system. To explain it in a short version and kind of a simplified version, if you think of a tube that has two bulbs on it, two bulb syringes on it, the biggest bulb syringe in the lower spine is at around the second sacral tubercle, what we call the lumbar cistern or the sacral well. The next bigger bulb syringe is in the ventricles, lateral, third, and fourth ventricles. And as the cranium and the dural meningeal system, and every time you breathe in and out and you move your transverse fascial plane, you compress one of those bulb syringes more than the other. And as you compress, let's say the cranial bulb syringe, it pushes fluid down into the sacral well. And the body has mechanics to understand when there's too much pressure or enough pressure in that sacral well. And when that expands, then what happens is the duromeningeal system will start to contract in the sacrum and push fluid back up into the cranium. So if you look at the system, it's kind of like this. Expansion in the cranial vault, compression in the duromeningeal system, expansion in the sacrum. And so what happens in sacral nutation is if the sacrum isn't moving correctly, let's say the lumbosacral angle is compressed, it's too small, which is what we measure in chiropractic. That means there's a posterior sacral base. That posterior sacral base can put pressure on that duromeningeal system or inhibit the full expansion of the sacral well or the lumbar cistern, and that again will affect the mechanics of the duromeningeal system, tension on the nervous system, nutrients to those nerves. So pretty much anything that we do in chiropractic, whether we want to own it or not, is affecting that duromeningeal system. And any structural aberration or subluxation also directly affects the duromeningeal system because the whole system is interrelated. It isn't separated by anything. Everything that happens basically affects everything else. So why the duromeningeal system is so important to monitor is because if that system goes awry and it causes tension on the duromeningeal system on the nerve roots, it causes immediate pathophysiological changes in when those nerve roots respond, even worse than compression factors.
Wow.
Yeah.
That was a decent amount of information. I think you went through like 2 or 3 of my questions I was going to ask.
Okay.
You're on point. You're in the flow. You're in the zone right now, which is amazing. I love that about you. I've seen you speak a few times, and I know that you have to bring a notepad and be very, very quick with your writing. So when you said more than, so it affects any type of flow disruption affects more than a compression fracture. Is that how you were saying?
No, not a compression fracture, a nerve root compression. So
nerve root compression. Okay, I don't know what else.
Yeah, we talk about nerve root compression and how damaging that is over time. What I'm saying is that, yes, nerve root compression obviously is damaging and painful and causes disruption, but actually tension, stretching of a nerve root, let's say in an abnormal birth process, forceps delivery, stretching on the nerve root actually causes immediate changes in the way that nerve root functions. So that's what the duromeningeal system controls. It doesn't control compression forces because you get compression in a nerve root. Let's say if you have exostosis, ankylosis, degenerative disc, these are compressors of foramina. But with the dura, if you pull on that dura at the dural port where it attaches to the nerve root, it creates changes in tension. So let's say, for example, you play guitar, all right? And you're playing guitar. When you want to tune your guitar, you change the tension on the tuning fork. As soon as you change that tension, you change the way that string vibrates and the pitch and tone of it. Well, the same thing happens to a nerve. If you pull on a nerve, you change the way that nerve vibrates, and you change its ability to transmit neurological impulses. So that's what I was relating to as far as that.
Yeah, that's really awesome. So what else? Let's see. Now, whenever we're talking about the disruption of it and
Right.
how that can affect your body and how
Right.
subluxations can affect this system, which also
Right.
affects your body.
Right.
Now, could we maybe talk about maybe some, let's say, examples or how we could see a physical manifestation in somebody with a flow problem,
Sure.
and how that affects their health and life even.
So let's start with the pediatric practice, only because it's really where you'll see the most dramatic flow.
For sure, and that's what we're talking about today.
So, for example, one of the big catchwords these days in pediatric practice is flagiocephaly. So a flagiocephalic head is a head that looks misshapen. If you look at it, one side's flat, one side's bulging. And so you can see what looks like an area that's full or bulging and the other area is flattening. So what causes that very often, or most of the time, is that tension on the dural system, because they're like strut fibers inside the cranium. So you have two sets of dural tissue. You have the falx cerebri, which attaches to the posterior pole of the ethmoid, the frontal lobe, all the way back to the occiput. And then you have the tentorium, which attaches from temporal to temporal to the anterior part of the falx and then to the occiput. So these are tension membranes, and that's what they're called. So if you picture cross-tension membranes, and then you picture the bones attached around those cross-tension membranes, if I pull, just like the old-time tents would used to have tent poles in the middle, and then they had the guide wires out there. If I pull one guide wire tight, what happens to the other side? The tent pole starts to, right? Exactly. Tent pole shift, and one side will bulge, and the other side will flatten. It's the same thing that happens with things like flagiocephaly. If there's dural stress, very often with flagiocephaly, you'll see torticollis. All right, and in torticollis, that is the dural system attaches very strongly around C2, C1, and occiput. Usually torticollis is the relationship between C1 and C2 and the rotational component in the cervical spine. So if there is dural stress there, and I pull, let's say I pull on this part of the tentorium, and I pull this part this way, what's going to happen is as I pull this part this way, I'm going to flatten the part of the occiput and the temporal bone where it attaches, and with this side is more flaccid, I'm going to allow this side of the bone to grow more rapidly, because the other thing that the dural system does in growth patterns is it affects osteoblastic to osteoclastic growth patterns by creating what we call a piezoelectric effect. And simply a piezoelectric effect is when you take a crystalline substance and you compress it, it sets off an electromagnetic field. So if you set off the wrong aberrant electromagnetic field, you can change the way calcium ions are deposited. If you set a more negative field from compressive forces, then calcium will be attracted to that area because it's a positive ion. If you set up a more positive field, calcium will be pushed away or not bond as quickly. So two things happen with flagiocephaly and with dural stress. It changes bone remodeling. Just like if I was to take my hand and hold it like this for 2.5 years, I'd get bone remodeling. So as those dural tissues pull on the cranium, they inhibit part of the growth pattern of one area of the cranium. The other thing that happens is inside the dural system is the subarachnoid space. The subarachnoid space is where the cerebrospinal fluid flows. And that is created by folds in the dural system in the cranium. So if I compress those folds in the dural system, I inhibit CSF flow. So the other thing that makes the cranial bones grow is when CSF pushes up against the cranial bones and allows them to grow and expand. So that would be a really easy way to see it when you look at a pediatric practice. So one of the things that helmets do is they do the opposite or the external aspect of what we do as chiropractors. So as a chiropractor, when we make an adjustment and reduce the subluxation, we change the tension on the dural system and we change the movement of cerebrospinal fluid. If we can normalize that, then we can get normal bone growth and development. What helmets do is from the opposite side or the outside, they put pressure on the areas that are growing too fast and leave a space in the area that isn't growing, which is very similar to creating a piezoelectric effect, except they do it from the outside. So they can press one and let the other area go, and that creates a different electromagnetic field, which changes bone growth. We do it from the inside by changing tension on the duromeningeal system. So that's one way. If we want to go into the adult practice, then you can talk about concussion. It's a very simple sign. A concussion, besides if the head bounces back into the skull, which it doesn't actually hit the skull because we have blood flow and duromeningeal system and subarachnoid space, but it smashes into that area and then it bounces back off. Two things happen. When it bounces back off, besides the contra-acute concussion we also get minor tears in that duromeningeal system because it's a connective tissue, just like if you sprain an ankle. You get tears in that system, and that makes that system less pliable. It also causes inflammation, which is why concussions are so damaging and could be long-term, is because not only do they injure the brain when you hit it the first time, but if they tear the duromeningeal system, just like if you tear a meniscus or any of your joints, you create swelling, and that swelling is inside the confined space, your head, and that swelling can cause the massive symptoms that we see with concussion. So that's a very other easy way to see how the duromeningeal system, besides the trauma, the compressive trauma or the hitting trauma in the brain, it's the swelling that occurs to the brain and the duromeningeal system. If that duromeningeal system isn't normalized and you keep that swelling in that duromeningeal system, then you're going to keep a constant pressure on the brain, which is why if people don't get proper care and just rest for their concussion, they usually don't get well, and they can also get more concussions on top of the other, because if you don't correct or heal that duromeningeal system, you're leaving it left with scar tissue, and as we all know, scar tissue is much less flexible than the normal tissue. So there's a couple of examples of how it happens.
Oh yeah, that's easy. You just laid that out there. Anybody could just see the importance of getting that type of care immediately.
Right, exactly.
It's phenomenal, the work that you do and many chiropractors do. So I have a question. So I actually was, you know what? Scratch that question.
Okay.
So what other type of important things should a student know going into, obviously, a 20, 35-minute webcast shouldn't be, this anybody's knowledge base. They should be reading books and seminars and classes and constantly doing things. Do you have anything else that you could let a student know, that a tidbit that would help them in either like expanding on what we've done here today already, or something that they need to look up, anything like that?
Well, I don't know if you're offering me this spot, but this is a great promo for the stuff that I do, which is basically teaching. So I teach for the ICPA. I teach independently. I've taught for SOTA USA. But if you go on my website, drmartinrosen.com, you can see what we've done over there. So I taught my first seminar. I figured it out the other day. I taught my first seminar in 1979.
Wow.
So before you were born. Which
my mom,
sucks for me, good for you. But the bottom line is, so over those years, we've compiled a lot of information. So what we've tried to do in the last 2 years is put them together in a workable format. So I wrote a new book recently last year, actually 1 year anniversary is in January. It's on my website. It's called Pediatric Chiropractic Care. But the first 2 chapters talk about everything I just talked about here. Besides the importance of pediatric chiropractic care, it talks about the cranial duromeningeal system, how it works. It talks about subluxations and what subluxations do to the nervous system. It talks about the different types of subluxation. So that's in that book, as well as giving you pediatric exam protocols and pediatric adjusting protocols with the spine and the cranium. The other thing that we did is all the other seminars I used to teach, we've been making DVDs. So we have a whole series of DVDs on SOT, the 3-category system, on cranial adjusting, on dealing with the sutural system, on the specific cranial bones, intraoral adjusting. We have things on tongue tie, scoliosis. We have spinal exam. So we have I think we have 13 DVDs right now, and we're working on some more. Vagus nerve release. So those are avenues that you can go to learn that. The other thing that I would suggest is look for techniques that are willing to give you an idea of what the scope of your practice really is. Like what you're really doing when you're making adjustments. So when I started school, I was an upper cervical practitioner, and I thought, and I still to this day highly respect upper cervical work. I think it's an amazing work. And when I think about the mechanics, I understand why it's so amazing, because when you make an adjustment to C1 or C2, you literally can change the tension on the germinal system above into the cranium and below into the spine. And that's why it's so powerful. You know, I remember Dijonette used to joke about Logan, because they knew each other. They grew up, you know, they practiced him, and he used to say, "Boy, I'll tell you, Logan was amazing. He put his hand on that sacrum, which was freeing segmentation. If he would just get his hand down to the butt, move it a little bit up the spine, he'd have the whole picture." And so what I'm talking about, and so they talk about, you know, the fact that techniques that are specific are really important. I know a lot of students get frustrated in school, and I know there are a lot of clinics out there and a lot of people that are, you know, numbers are very important, and I'm not saying they're not, and making money is a good thing, but specificity in your adjustment is important. So I found a technique that spoke to me, which was SOT. And I've broadened that out to fit into pediatric practice, and I've done my work, and I've written my books, and I've put my stuff online for that. But the reason it worked for me is because the technique really spoke to me, and it had a vast impact on what I could do with the nervous system. Some of the best chiropractors I've seen and met anyway that have the most successful chiropractic practices are those people who are invested in what they do in their technique, whether it be upper cervical, whether it be Gonstead, whether it be Logan Basic, whether it be Network, whether it be SOT, even whether it be diversified, as long as they have a system. And I think that's what's really important for students, is to get a system that speaks to you, that's reproducible, and that gives you a baseline so you know when you make a change. So instead of someone saying, "Oh, doc, you know, it feels a little better here, or my neck's not as tight, or my headache went away," that's not a baseline of how the nervous system is functioning. You know, if you and I, when we get down to Georgia, if you and I go out, we have a few drinks, and then we go to the seminar that morning, we're both probably going to have a headache, but that doesn't mean that our nervous system's not functioning. That's a normal process. But I would like to know how your nervous system is functioning. So you need a baseline. You need a technique that gives you a baseline. It says when X, Y, and Z occurs, there is a subluxation. When you make an adjustment into this area or these areas, and you change X, Y, and Z, then you've started to help the nervous system heal. So that's what I would say to look for when you're looking for a technique and when you're really wanting to study it. And own it. Own it as your own. Doesn't mean you only have to use one technique, but at least start with mastering something before you start to find, "Oh, I want to do a little soft tissue of this, or I want to do a little of this, or I want to do a little of that." Take the time, because what will happen in your practice, and how my practice grew, is I found something that worked. I used it, and when I felt like I really mastered it, which could have taken a year, could have taken 5 years, depending on what it was, I added something else to my practice. And when I added that, then I got to attract other patients and new patients. But if you just think you're doing a little of this, a little of that, or you're very unspecific, my experience is that you'll have a more difficult time in practice and in life, because you really need to be, you know, chiropractic, just like a lot of other things, medicine, a lot, it's not just a job, it's a profession. And what makes it a profession is that you're invested in it, it's your lifestyle. You know, people ask me, patients ask me questions about it, and I say to them, I said, "Look, this is just not what I'm telling you to do. This is what I do in my life. This is how I live my life. This is how my children were raised. This is what we do. So whether you accept it or not is fine with me. Just understand that this is not a sales job. This is what we do." And I think if you embrace it that way, that this is your lifestyle and this is what you do, and, you know, who would you want? You know, think about this. When you get out of practice and you get out to school, if you could list 5 chiropractors that you would want to get adjusted by, if you could, you better be on that list. If you're not on that list, then you got a problem.
For sure. That's really important for people to know. I know that in the people that I surround myself in school and outside of school, we all know that we really need to focus on being the best at one thing and what we do, and focusing. For me, I really enjoy upper cervical, knee, chest, and it speaks to me. I love it.
Absolutely.
And so I do seminars, I read, I do all this stuff, and I try to be as specific as possible. There's a lot of people that in my class and whatnot that their definition of specific isn't the same as like our definition of specific. There's a a level of mastery that needs to happen that
Absolutely.
people don't quite get yet. So that was really enlightening for you to say.
Yeah. You know, sometimes people, and chiropractors, sometimes people will spend more time finding a mechanic for their car or a carpenter to build their house and check them out and want them to be the best they can. Well, wouldn't you want the person who's working on your body to be that? And wouldn't you want to give that to your patients? You know, your ability. It's not like every patient's going to get well. Not every patient's going to stay with you, and not every patient's going to resonate with what you do. Like there may be people that when you do your upper cervical work, hey, you just punch me in the neck, doc. You know, and they may not get what you do. You know what you did. As long as you know what you did and you're true to what you did, then you can tell the person, look, this may not be the right place for you. Let me send you to, you know, my friend down the street. They do a different technique. That should be what we would do in chiropractic. And some techniques work differently on different nervous systems. Some higher velocity, higher force techniques are more accepted by some people. Some people need lower force techniques. You know, we really have to understand that in the chiropractic profession. It's just not one suit fits everybody. But like I said, as long as you have parameters that you know you've made a change, you can tell the person, look, and I do this with my patients all the time. I'll say, look, objectively, and I'll sit them down when I do their programs and say, objectively, these are the changes that have occurred. Now, I don't know if that translates to you how you feel subjectively. But now, which is the only time I usually do it on my program, now is your chance to tell me that. And they'll say, oh, yeah, I'm feeling a lot better. I feel this or this. Or they may say, you know, I don't feel that much different. And then I'll say, well, look, objectively, things are changing. Why don't we, you know, stay on this path if you're willing to for several more weeks and see if my objective changes meet some of your subjective needs. If not, then we can talk about what else to do. You know, and I think that's a fair way to do it.
Yeah, that hits the nail right on the head for me. That was great.
Right.
So for our, we're I guess wrapping up because we already gone over so much in this short webcast. Is there anything, closing statement, anything that you'd like to say? Anything else? I know you've said so much already.
Yeah, there's one thing I'd like to close with.
All right.
Like to close with, and I'm sure we've all heard this, or a lot of us have heard this, and a friend of mine had said it many years ago, that one of the biggest problems that chiropractic has is that when we get attacked from the outside, we all start to circle our wagons, you know, to protect it. And then after about a few minutes of circling our wagons and protecting the profession, we start shooting at each other. And I think that's the number one thing that we really need to stop doing. What we do as chiropractors should not be something that we consistently argue about or beat up each other. You know, we need to be able to accept what each one does. And, you know, I mean, social media, I know your generation, you know, social media is out there. Some of the things I see on social media, and I don't go on a lot, but some of the things I say, wow, this has got to be bad for our profession. This is crazy stuff that people are saying to each other. So I think that as when you're a student, and, you know, being a student's tough and school's expensive and there's, you know, and sometimes you can get negative by the stuff, bears down, but really understand that a lot of the people out there are your colleagues. And if you want to move the profession forward, then it needs to have a good presence, whether that be on Facebook, Instagram, Pinterest, you know, whatever, you know, but it also needs to have a good presence out there. Like I don't, you know, sometimes patients will come in and say, oh, I went to this guy for 6 months and nothing happened. You adjusted me twice and now I feel better. What's wrong with that guy? I'm like, nothing. There's nothing wrong with that guy. That's happened to me too. I remember when I started practicing that. And so you have to understand, you know, oh, that guy's terrible. He does that really weird technique. You know, he stands over you and chants and touches you. It's just, we can't do that. We have to stop doing that. So that's what I would implore people to stop doing, is to stop beating each other up, whether it be in social media, on time, and to embrace the chiropractic principle of what we do and how effective what we do is, as long as each of us is maintaining integrity. Yeah, so somebody's being out of integrity, then call them on it. But call them on it, like face-to-face. Don't call them on it on Facebook. As far as I'm concerned, that's a real cowardly way to work with people. If I want to tell somebody, whether it be a friend or foe, that they've done something out of integrity, then if I can't get there because they're far away, I pick up a phone, but I don't go on Facebook or Instagram or whatever it is, or it's not the way to do it. It's face-to-face. You want to tell somebody something and give that person the opportunity to explain their point of view. But that's it. That's all I want to say.
Thank you so much. Can everybody see me? So, yeah, thank you so much for joining us tonight. I have learned a ton, even in school right now learning SOT. We haven't gone over in depth that type of thing. Maybe we will in the future. So yeah, I am so grateful that you joined, and I hope everybody else takes away as much as I did and continue learning. In 2 weeks from today, we'll be sending out our next video webcast. We have a couple of recordings going on, so I'm not exactly sure what we're doing next, but we have a lot of great speakers and presenters to come. So,
and Caleb, I just want to thank you for your work, because I don't know how you get acknowledged, but I know how much work this is, and this is awesome that you're taking your time. You know, at 7:30 at night, you probably just got home from school doing this. So I applaud you. That's really great. We need people like you to keep doing that.
Thank you so much. All right, guys. Y'all have a good night, and we'll see you in 2 weeks.
All right. Take care. Bye-bye.